Thank you very much. Morning, afternoon, everyone. There's two of us here because we couldn't agree who would get to come along and talk today, so we both came. Very mindful we're between you and your lunch, so we will aim to finish on time. Damon is head of DC Consulting at Broadstone. I'm head of health and risk. So we naturally have a slightly different perspective on the challenges facing the employee benefits landscape, but between us we will try to cover both angles today. I'll start by quoting W.B. Yeats, just because he is one of my favourite poets. All is changed utterly. I'll avoid the words unprecedented or perfect storm because they're massively overused. But we certainly have a unique conflation of pressures bearing down on the workforce and on us as employers. We've got increased financial security and deteriorating financial well-being, and we'll see some stats to prove that. We have a public health crisis, and I don't use the word crisis lightly, that is now manifesting itself throughout the workforce in our sickness absence rates, in our productivity, in our levels of economic inactivity. And we have rising recruitment costs, a static or contracting recruitment market, and rising expectations from employees about what employers will provide. A lot of those shifts in expectations came during the pandemic and they haven't gone away. So in the next 18 minutes, we will try to explore the impact of the public health crisis on the workforce, the impact of the cost of living crisis, the resulting shared challenges we all face, and the effective strategies with which to address those challenges. An ambitious agenda in what is now probably 17 minutes. So we'll jump right in. The NHS waiting list, you may have seen this chart before. It was rising steadily ever since 2012 due to NHS funding consistently being held below inflation, so declining in real terms. It was around 4.46 million in February 2020. It's accelerated, I would say exploded since then, up 70% since then. It started to plateau, and then the industrial action kicked in, and now it's accelerating up again. There are some other stats behind that aren't in those waiting list figures. I think the important one there is 36 million fewer face-to-face GP appointments carried out last year compared to 2019. That's a massive shift towards telephone appointments. Keep that 36 million in your head because it has consequences that we are seeing manifest elsewhere in the system. Sickness absence rate up 37%, now the highest since 2004, and that is in public sector and private sector. And that's now having a direct cost to all of us, 186 million working days lost to sickness, £568 direct cost per employee. That doesn't include the indirect costs as well. So that's where waiting lists have been and are now. Where might they be going? There is a saying, forecasting is for fools, but we'll look at some forecasts anyway. Institute for Fiscal Studies was running forecasts throughout the pandemic about exploring different scenarios around the extent of pent-up demand and the return to productivity and where waiting lists could go. The yellow line is their central forecast, and this was their last forecast done in February of this year. The purple line is their worst case scenario. Now, we look at this every month and we look at where the actual waiting list is. It is bouncing around between that yellow and purple line. And when they last did their forecast in February 23, we hadn't had the industrial action, so they weren't able to factor that in. So we are on track for somewhere between that yellow and purple line. The Health Foundation a few weeks ago did their own forecast that predicted 8 million by next summer, even if there is not another day of industrial action. Why does that matter? Well, it matters to society, obviously, but for anybody with a private medical insurance scheme for your employees, it really matters because that overlays the waiting list with the rise in average claims cost per life seen by one of the biggest private medical insurers in the UK. I won't say which one, but it's one of the big ones. And the correlation there is striking. Inability to access the NHS drives direct demand on private medical insurance. There are other things we're seeing going on within that PMI claims data. There's a huge rise in the incidence of claims. People will quote you numbers of anywhere between 20 to 30% year on year in claims count. Within that, Huge rise in the number of outpatient consultations being driven by the explosion in the use of digital GPs. Remember those 36 million people who aren't having face-to-face GP appointments. They're turning to the digital GP services in their healthcare products. Some of the providers report usage 20 times per month greater than it was in 2019 on those services. There are limits to what a digital GP can do. They can't physically examine you. So if they have any doubt, they refer you on. They know you have PMI. So huge rise in outpatient consultations. But there's also the things that get missed from that loss of face-to-face GP interactivity. The one thing they can't do is say, while you're here, roll your sleeve up, let's just check your blood pressure. British Heart Foundation in February of this year released some statistics showing there were 500,000 fewer diagnoses of new blood pressure medication than they would ordinarily expect, and that's a direct consequence of people not seeing their GP as much. That blood pressure is still there. If anything, it's more prevalent because as a society we are less active than we were before the pandemic. We're drinking more, our habits have changed. So there's probably more blood pressure out there. It's being diagnosed later. It's not being controlled as well. So it is manifesting later as cardiovascular conditions. And insurers, both healthcare and life insurers, are seeing a rise in claims for cardiovascular. Post-pandemic rise in MSK conditions. As I said, we're less active, so that makes us more prone to these conditions. Huge numbers of us are spending an awful amount of time working at home, perhaps hunched over a kitchen table, over a laptop that wasn't designed to be a workstation 5 days a week. MSK conditions are coming through strongly wherever you look now. And a big increase in the cost of cancer claims. Big disruption to cancer screening services during the pandemic, but again, less people spending face-to-face time with their GP. The GP notices something's not quite right, you look a bit peaky, is everything okay? And just having that open conversation. On cancer, just to illustrate that, these are rates of diagnosis of two of the most common cancers, bowel and breast. You can see the big drop during the pandemic and the big rebound. Look at the rates for diagnosis of bowel cancer. That's not new bowel cancer. It's the same bowel cancer but wasn't being diagnosed before. It's just coming through later. So instead of stage 1, stage 2, it's stage 2, stage 3. The diagnosis is later, the treatment is more complex, the treatment is more costly. Sadly, in some cases, the outcome less favourable. All of that is feeding through into levels of economic inactivity due to ill health, which are up now nearly 500,000 from before the pandemic. Within that rise, 31% of that is a rise in MSK conditions, 22% is serious mental illness, and the 41% of other, that other is all that stuff that's sitting in that NHS waiting list, untreated. And within that NHS waiting list, it's 7.77 million. That's not 7.77 million, it's estimated to be around 6.7 million, because 1 million of those people are now on the waiting list for more than one thing. And that is a classic example of failure demand. The failure to provide the service creates more demand for the service. Sadly, as I say, some of that manifests in the worst outcomes. Morbidity rates are up. The UK death rate is significantly up on the 5-year average, and it's not just the old. It's impacting the working age population, 25 to 64 age range there. Again, this is from one of the leading group risk insurers. If you look at the GRID data, the group risk organisation, 35% increase in the number of group life claims paid last year compared to 19, 31% increase in the value. There was an increase in the insured population over that period, but only 10%. So the incidence is clearly higher. Now, right now, that's not translating into impact on group life premiums because we're in a high interest rate environment. Group risk insurers, group life insurers are essentially investment companies, but pay out cash when one of their customers passes away. High interest rates, better return on investments, so it's offsetting some of that premium pressure. Interest rates now thought to have peaked, likely to start coming down next year, albeit slowly. If these mortality rates don't change and the interest rates come back, we will see some of that upwards pressure on premiums. On the financial side of things, more Damon's world than mine, but I will touch on it. That's the UK growth, or more pertinently, lack of growth over the last couple of years. We are in a low or no growth environment. That's interest rates, top two lines, CPI with and without housing, bottom line, just housing costs. about to converge in a very unpleasant way for society, and that is the UK, so inflation on the left. Apologies, interest rates on the right. Interest rates on the right, in terms of the impact of that next year, there's 1.6 million people are going to come off a fixed rate mortgage next year. There's 2.1 million people bought a new car in 2021, 2020, typically on a 4-year lease. So all of those cars will come up for refinancing next year as well. So there is a delayed shock when you put up interest rates. It takes a long time to feed through the system. We are not out of the woods yet, just because inflation is now starting to come down. That's manifesting itself in the population in terms of an increase in mental health, and we know that poor mental health translates into poor physical health. 34% suffering from anxiety, 29% suffering from stress, 10% feeling feelings of hopelessness. And it's not just for young. There is a cliche there that mental health affects the young disproportionately. It's hitting Generation X. A lot of that is to do with those mortgage pressures that are coming through. 1 in 4 say that managing money is causing them to lose sleep. 54% feel stressed about their finances. So, we have worsening public health services, deteriorating financial health, declining levels of physical and emotional health, rising sickness absence rates, rising insurance claims, growing pressure on health and risk premiums, and rising employee needs and expectations. Quite a knot to untie. Damon is going to solve all of that for you in the next 8 minutes. No pressure.
Comments before we start. So, a really complex situation as HR, reward and employee benefit professionals. I don't envy you, but part of our role is to support you. What I'm going to give you is probably 4, maybe technically 4.5 things that I think could really help in the way you offer, design and communicate your employee benefits to support your employees. Just a bit of a warning though, there's no silver bullet. There's no, certainly not an affordable one. There's no silver bullet, and what I'm going to discuss is not earth-shatteringly complex or particularly innovative, if I'm completely honest, but often the most effective solutions are the most simple. So just 4 things that you can take away, chew the fat over lunch and hopefully beyond, and think, well, how can I perhaps apply some of that to supporting my employees? So the first of the 4 things is to educate. And quite nicely, we've just had Sarah talk about financial well-being, the importance of communicating, the importance of supporting people. That, and I can't stand a cliche. Brett and I have got one thing in common. It is that we can't stand a cliche. But knowledge is power. If people understand the issues they're facing better, what they can and can't control, and what they can do to control the things they can control, they'll feel inherently better and more comfortable about the challenges they're facing. So education is really important. Communication is absolutely critical. That's the easy bit. That's the no-brainer. We all know that. As reward employee benefit professionals, you know the importance of engagement. You know the importance of communication just in life, never mind in the context of employee benefits. The difficult part is making that effective, right? So without going through each and every one of these points, I'm just going to call out a few. Firstly, understand what challenges your employees need support with. And even in a relatively homogenous workforce, recognize that people are different and they're going to have different challenges. Understand those challenges, understand those priorities, and target your communication and your support accordingly. Be positive. I know, given what Brett's just told you, there's not a lot to be positive about, but there's always reason to be positive. So falling house prices, for example, is good news for first-time home buyers. High interest rates are good news for savers, right? So you can still enforce positive news and positive behavior while trying to support with some of the challenges that people are facing. As Sarah said, Be flexible with your delivery methods. Once you've identified the priorities and challenges your employees need support with, you've segmented them, you've targeted the messaging, you've got the messaging right, that will be completely undone if you don't get the message across effectively. And given the range of options, technology and old-fashioned stuff, written stuff, presentations, nudges, apps, the whole works, think carefully about the most effective communication method and medium. Explain, don't just quantify the value of your employee benefits. I know that's an odd thing to say. Don't just tell people they get a 5% pension contribution or 4 times life cover. Tell them the value that that could deliver in later life in the event of an unexpected event in their lives. Leverage your insurers and providers. Again, it's almost like Sarah and I had coerced beforehand, but leverage your insurers providers. They're there to support, and frankly, they're there to try and manage the risks that they face as well. You'll be surprised just by asking how much support you'll get from those providers. So educate is number 1. The next 2 I'll go through pretty quickly because they're simple concepts. You may have, as I said, a fairly homogenous workforce. You may not. But without recognizing that every individual will have different needs and priorities at different stages of their life, it's almost impossible to have an effective, valued employee benefits package. As an example, let's take a 23-year-old coming into their first job. You offer a great pension contribution of 10%. That, on the face of it, looks like a very generous benefit. It may be more valued by that individual if you put 5% into their pension and 5% into their LISA to help them purchase their first property. So it's not just about richness of benefits, it's about whether it's meeting a need. So be flexible with your benefits package and how that's delivered. Promote healthy, which is the second and a half or third point, healthy living and behaviors. And not just through communication, not just encouraging people to join the gym through rewards and initiatives. Make it part of your organizational culture. Make sure you live and breathe healthy living. Use your EAP and cash plan. I'm pretty sure you've all got an EAP, if not a cash plan. Pretty cost-effective solutions, but probably the most underutilized, both in terms of intervention and prevention and support to employees. The third takeaway is invest. Brett mentioned this number earlier. 185.6 million working days were lost because of sickness and injury in 2022 at a cost of £568 per employee. Not per sick employee, per employee. So the business case is obvious, right? The things that I would invest in are training colleagues to help each other. That's really important and a pretty cost-effective way of supporting each other. It's also rewarding and motivating. Offering some sorts of financial advice and guidance, and then preventative and intervention measures such as occupational health and health screening. Investment, the third. The fourth and last takeaway is good governance. You could have the richest employee benefits package in the world, but if the insurers and the providers aren't doing what you expect them to do, completely undermines the worth of those providers. The top left-hand table is a summary of investment performance from a handful of DC pension master trust providers. And the point is simply that the difference in this cohort between the best and worst performing investment strategy is over 6% per year. Right? To put that into context, imagine adding 6% into your employee's pot every year. So over 6% difference in investment return. Unless you understand that, unless you've got that oversight, you don't know whether your pension scheme is doing a good job for your employees. Ultimately, at the heart of it, a DC pension scheme is an investment vehicle. If it's not doing that job well, it's not doing its job. And just very quickly, on the top right-hand bar chart, That's an actual graph from one of our clients' reports, which shows what is driving PMI claims for that particular client. In that case, between mental health and MSK claims, both which Brett said is on an upward trajectory, are significantly driving PMI claims, but actually are fairly easy to manage with the right interventions. So having oversight and good governance is the fourth. So, sum up, educate, be flexible with your benefits and promote them, invest in preventative measures, and adopt good governance.